is a question practice session, and here the first question is: a woman is hospitalized for the treatment for severe preeclampsia. Which of the following represent an unusual finding for this condition? So here the patient is admitted, or the woman is admitted with severe preeclampsia. So here 4 options are given, or 4 signs of preeclampsia related with that is given, and which of the following represent an unusual finding for this condition? So the keyword for this question is unusual finding for this condition. Okay, so the options are given: convulsion, high blood pressure 160/100, proteinuria 4+, and generalized edema. Okay, so before selecting the answer, let me just explain what is preeclampsia. So preeclampsia എന്ന് പറയുന്നത്, it is hypertension after 20th week of gestation. Usually this is affected in pregnant mother. Usually after 20th week of gestation, if the BP shoot up, it causes gestational hypertension, preeclampsia and eclampsia. Okay, normally during pregnancy or in the initial stage of pregnancy, as a physiological changes, there will be chances to get low BP in the initial stages because of hormonal changes. But when the day advances, or when it reaches almost to last of first trimester, the BP returns to normal. Initially, there will be chances to get hypotension. That is a common thing. Okay, but after 20th week of gestation, because of placental abnormality, preeclampsia and eclampsia, any of these things, okay, it is the subdivision of gestational hypertension. Okay, we'll just see what is the pathophysiology of preeclampsia. Okay, so let me just explain this. See, this is a placenta, whereas uteroplacental vessels, it is considered as spiral artery. See, these spiral arteries are necessary for giving nutrients from the mother to the placenta as well as for the fetus. Okay, usually during pregnancy or during the antenatal period, as a physiological changes, these spiral arteries will dilate excessively. It get dilate, and that will allows large amount of blood to the fetus. I repeat, pregnancy as a physiological changes, ഈ ഓരോ സ്പൈറൽ ആർട്ടറീസും ഒരുപാട് ഡയലേറ്റ് ആവുകയും as a result of that dilated ആയിട്ടുള്ള ബ്ലഡ് വെസലിലൂടെ ഒരുപാട് ബ്ലഡ് മൂവ് ചെയ്യും. ഓക്കെ, സോ അങ്ങനെ പ്ലാസന്റയിലേക്കും അതേപോലെ തന്നെ ഫീറ്റസിനും എക്സസീവ് ആയിട്ട് അല്ലെങ്കിൽ adequate amount of nutrient, oxygen and the necessary things. Okay, so ഇതെല്ലാം കിട്ടും. Okay, but what happens in preeclampsia? Preeclampsia, these particular spiral artery defective ആവുന്നു, or it become fibrotic, or it get narrowed. As a result of that, oxygenated blood supply towards the placenta or towards the fetal reduces, and it causes placental hypoperfusion. It causes placental hypoperfusion. So placental ischemia happens. What is ischemia? In case of hypoperfusion, there will be chances to get ischemia. It is an inflammatory changes of placenta due to hypoxia. Okay, so ingane placental hypoperfusion varumbo, or as a result of hypoperfusion of placenta, the placenta releases, or the diseased placenta releases pro-inflammatory protein into the maternal circulation. Okay, so for example, cytokine പോലെയുള്ള chemical components ഈ diseased placenta release ചെയ്യും, and that will be released into the maternal circulation. Okay, so these pro-inflammatory proteins, all of these pro-inflammatory proteins will reach in the maternal circulation, and it causes damage of endothelial cells. Endothelial cells are the layer of the blood vessels. Okay. But endothelial damage causes vasoconstriction. I repeat, endothelial damage causes vasoconstriction. Clear are you? So the blood vessels get constricted and it increases BP. Okay. So this is how hypertension happens during antenatal period. That is called as preeclampsia. Okay, if patient has preeclampsia or mother has preeclampsia along with seizure is called as eclampsia. Okay, അങ്ങനെ hypertension ഉണ്ടാവുന്നു and plus all of these pro-inflammatory proteins will damage the organ. So it damages kidney as well as liver. Okay, so it damages kidney. So as a result of kidney damage, there will be proteinuria. Okay, and liver damage varumbo liver functions alters avunu. So group of symptoms will be expected that are HELP syndrome. HELP syndrome, HE which relates hemolysis, E elevated liver enzyme, L stands for, and low platelet. HE hemolysis, elevated liver enzyme, low platelet. These are the cluster of symptoms. Okay. So preeclampsia, it is characterized by HELP syndrome and proteinuria. And there will be edema. Urine output will be reduced. Okay. So these are the signs and symptoms of preeclampsia. I repeat, after 20th week of gestation, in case of mother, if her BP start to increase greater than 140/90, it is considered as gestational hypertension, and gestational hypertension has two parts, preeclampsia as well as eclampsia. Preeclampsia is characterized by HELP syndrome, proteinuria, oliguria, edema, increased BP, and creatinine will start to increase because of kidney damage. Okay. And along with preeclamptic symptoms, with seizure, if the mother start to develop seizure or any damage related with the brain, confusion, irritability, with a seizure. Okay, so this particular phase is considered as eclamptic phase. Clear are you? I request all of you to please note down all of these things. So we'll be back to the question. So here the client is admitted or the mother is with severe preeclampsia. So remove the wrong answer first. So you have to select the keyword is unusual finding, which is not related with eclampsia. Okay, so here preeclampsia, hypertension, weight gain, proteinuria, edema and seizure. Seizure is associated with eclampsia. You have to just learn this. Clear? Please write it in your book. Preeclampsia is characterized by hypertension, weight gain, proteinuria, edema, and if mother develops seizure, it is considered as eclampsia. So what could be the answer for this question? Unusual finding. So it is convulsions. Clear are you? So the answer for this question is convulsions. See, hypertension, proteinuria, generalized edema is a sign of preeclampsia. Clear? So we'll discuss another question. A woman is admitted with preeclampsia. It is severe preeclampsia. What type of room should the nurse select for this woman? Again here the mother is with a severe preeclampsia. So what type of room should the nurse select for this mother? Okay, so this particular mother is with a not only mild preeclampsia, it is severe preeclampsia. So anytime this mother may develop seizure. So you have to provide calm, quiet environment because sound, excessive light, these are considered as environmental stimulus and that will stimulate the central nervous system and it causes or it contributes seizure. So you have to provide very calm environment. So please select the answer. Option number 1, a room next to the elevator doesn't require. Option number 2, the room farthest from the nurse's station. Always the room should be nearest to the nurse's station so the nurses can immediately go and visit the client. So option number 2 is also wrong. Option number 3, the quietest room on the floor. Yes, that can be selected. Option number 4, the labor suit. No, it doesn't require. So what's the answer for this question is option number 3. Okay, so this is the answer. Next question. Yeah, you can just write it down this. If a client or a mother has pregnancy-induced hypertension or gestational hypertension or preeclampsia or eclampsia, how would you treat? Okay, you can just remember this particular thing. It is PEACE. Okay, you can remember PEACE. P stands for promote bed rest. That means quiet environment need to be given. And E is ensure high protein diet, because proteinuria is all associated with this. Okay, so excessive protein loss causes decreased protein or decreased transportation of a protein towards the baby, and it causes malnutrition or something like that, growth retardation, all of those things. And protein can be given. And third is antihypertensive medications. Here hydralazine can be given. Hydralazine, when you give hydralazine, it will reduce the BP. And convulsions, you can administer magnesium sulfate. So what is the choice of treatment for preeclampsia and eclampsia? Yes, it is magnesium sulfate, because magnesium sulfate is considered as an antihypertensive medication. That is mainly direct acting antihypertensive medication. So when you administer magnesium sulfate, it will directly act on the blood vessels, and suddenly soon the muscle relaxation might occur, and it causes hypotension. Okay, so which is the expected finding. Okay, apart from that, when you administer magnesium sulfate, please note the side effect of magnesium sulfate also. So since it is a muscle relaxant, it causes respiratory arrest. Hypertension, respiratory arrest. Apart from that, there will be depressed deep tendon reflux. Okay, so these are the side effects of magnesium sulfate. So the last is evaluate the physical parameters. Okay, so please remember PEACE. The last E stands for evaluate the physical parameter. What all are the physical parameters that you need to assess? First one is blood pressure, second is urine output, third is respiration, and last is patellar reflux. Why blood pressure? Because this particular medicine will reduce BP. Yes, that is required. And urine output, as a side effect of magnesium, urine output will reduce. There will be chances. Okay, so urine output can be assessed. And respiration, already I said it is magnesium is considered as a magnesium is considered as a muscle relaxant, and it causes respiratory arrest. Fine. And patellar reflux, it is deep tendon reflux, that will be suppressed. Okay, so deep tendon reflux is suppressed angle. You can just assess by assessing the reflux by knee hammer, or you can just ask the mother to walk. If she is not able to walk in a normal way, that is indicating she is not able to give more pressure towards the heel. Okay, so usually when this patellar reflux is depressed, the patient will walk, or the mother may walk by using toe. Toe walking indicate magnesium is high. Okay, so please remember all of these things, because these are the frequently asked questions. Okay, so there are many questions from preeclampsia, gestational hypertension. Okay, not these questions. Apart from this, there are many questions. So next question. A 22-year-old woman has missed 2 of her regular menstrual period. Her doctor confirms an early intrauterine pregnancy. This is her first pregnancy. To determine her expected date, which of the following assessment is most important? So question very clear aana. Question 22-year-old woman. She has lost her or missed her 2 regular menstrual period. Okay, and doctor confirm chedu intrauterine pregnancy. Okay, so how do we assess expected date of delivery? That is expected due date. Okay, so option number 1, date of first menstrual period. Option number 2, date of last intercourse. It is wrong. Option number 2 is wrong. Option number 3, date of last normal menstrual period. And option number 4 is age at menarche. Age at menarche and date of last intercourse are wrong answers. So you can remove these 2 answers as wrong. And you got two answers now. One is date of first menstrual period and you got a date of last menstrual period. So what is the answer? Yeah. So if you wanted to assess EDD, you need to identify LMP first, last menstrual period. So what is the answer for this question? Yes. So this is the answer. It's very simple. Hello. Yes. Next question. A woman has just delivered a 9 Libra 10 ounce baby. After the delivery, the nurse noticed that the mother is chilly and that her fundus has relaxed. Okay, the nurse administered oxytocin based on the physician's order. What occurrence will alert the nurse that the oxytocin has had the expected effect? So here you have to select expected effect of oxytocin. What is the expected effect? Effect you may be knowing. Okay, so you must be knowing effect, and not only effect, you have to select the expected effect. What is the expectation? What do you expect? You expect only the good thing. Okay, you never expect the wrong thing. So you have to expect only the good thing. So here the effect of oxytocin, that is also you have to select the good effect. Fine. So question clear, are you? So let me explain once more. A mother recently delivered, okay, and nurse noted the mother is chilly and that her fundus has relaxed. Okay, nurse administer oxytocin based on the order. Okay, appa oxytocin better effect aanu nammal select cheyendathu. Clear? Okay. Option number 1, the mother states that she feels warmer now. See, oxytocin is not given to warm the patient. Okay, so it is wrong answer. So you can remove that. So I think I'll just cut the answer. Option number 1 is wrong. Option number 2, the mother falls asleep. Again, this particular medicine is not giving to induce sleep. So you can remove that. Yeah. The baby cries. It is not related with this. Okay. So the last answer is the uterus become firm. Yeah. So the correct answer is option number 4. Okay. So always think the effect of oxytocin. So that also you have to select the expected effect of oxytocin. Okay. So usually this type of questions, questions ആയിട്ട് വരാറുണ്ട്. So usually expected outcome, expected effect, അങ്ങനെയൊക്കെ ഒരു word വരുമ്പോൾ usually confused ആവാറുണ്ട്. So don't worry. Next question, it is very important question. A woman in labor is placed on an external fetal monitor. The nurse noticed that the fetal heart rate is erratic during contraction but returns to baseline at the end of each contraction. How will this occurrence be recorded? Question clear, ayo? A woman in labor is placed on an external fetal monitor. Okay, nurse note on a fetal heart rate. Okay, and the fetal heart rate is erratic, it is unpredictable, or it is not on regular basis. Okay, so erratic, what is the meaning of erratic? It is unpredictable or it is not a regular pattern. Okay, during contraction, but it returns to the baseline at the end of each contractions. How will this occurrence be recorded? Option number 1, early deceleration. Option number 2, variable deceleration. Option number 3, late deceleration. And fetal distress. Okay, so you can cut option number 4. It is not fetal distress. Okay, when you assess external fetal monitor, when you assess the fetal heart rate along with contraction, okay, there will be 3 different kinds of deceleration will be expected. So we'll just see that early deceleration, variable deceleration and late deceleration. Okay, so we'll see what is early deceleration. Early deceleration start when the uterine contraction begins and it recover when uterine contraction stops. I repeat, early deceleration starts when the uterine contraction begins. Okay, that is deceleration. What is deceleration? It is going down. Okay, so fetal heart rate is going down. So it starts when the uterine contraction begins and it recovers when uterine contraction stops. Along with the graph I'll show you. And variable deceleration. What is this variable deceleration? Variable deceleration are observed as a rapid fall in baseline fetal heart rate with a variable recovery phase. And the last is late deceleration. Late deceleration begins at the peak of uterine contraction and it recovers after the contraction ends. Okay. For example, usually fetal heart rate monitor ചെയ്യുമ്പോൾ there will be normal pattern of fetal heart rate and there will be contraction. So for example, if this is a contraction, let me just draw this, then I'll explain. Okay, if this is a starting of contraction, your pointer, this is a starting of contraction and this is the ending of contraction. There is no contraction here and this is starting of contraction, this is the ending of contraction. Okay, so eppozhum ee contraction la there will be a peak contraction here. This is the peak contraction. Okay, what happens in early contraction, early deceleration? Endana early deceleration la sambhavikkunnathu? When the maternal uterine contraction starts, at the same time, there will be deceleration of fetal heart rate. What is the normal fetal heart rate? It is 120 to 160. Okay, so from the baseline, if it is something, it is 140, what happens? From 140, it start to reduce. Okay, when it start to reduce? When early deceleration start, when the uterine contraction begins. എവിടെയാണോ uterine contraction begin ചെയ്തത്? It begins at here. Okay, so if this is a fetal heart rate, when it reaches here, it drops. Okay, then it returns. Okay, this is something early deceleration. Okay, usually the deceleration should start at the peak of contraction. But in early deceleration, the deceleration start before the contraction or before the peak of uterine contraction. Clear? And late deceleration, what is late deceleration? Late deceleration begin at the peak of the uterine contraction. Okay, so peak is, this is the amplitude here, it is peak. Okay, so late deceleration what happens? The late deceleration begins at the peak of the uterine contraction and recovers after the contraction ends. With graph I'll show you. And what is variable contraction? Variable contraction you cannot predict. It will be, there will be a varying degree. So let me just show. Yeah, see, this is the picture. So early onset, it is early deceleration. So what happens here? The fetal heart rate is given. Okay, this is the contraction. Contraction starts here, contraction ends here. Next contraction starts here and it ends here, and next contraction starts here. Clear? Okay, so early deceleration this is the peak. Okay, so a peak start ചെയ്യുന്നതിന് മുമ്പ് തന്നെ contraction start ചെയ്തു. See here, this is the normal rate of fetal heart rate and it's dropped down. Okay, and it returns to normal. Okay, ഇതിനെയാണ് early deceleration എന്ന് പറയുന്നത്. Okay, and late deceleration. Okay, so this is the late onset or late deceleration. Late deceleration, this is the peak here. Deceleration starts after the peak. മനസ്സിലായോ? ഇവിടെ deceleration take place late or after the peak of uterine contraction. So that is considered as late deceleration. And this is variable deceleration. So this is the uterine contraction here which is shown. And this is the peak of uterine contraction. But see, just compare between fetal heart rate as well as the deceleration. If you compare, you are not able to correlate between the contraction as well as the fetal heart rate or fetal heart rate deceleration. Okay, so I repeat, there are three types of deceleration. Early deceleration, which is considered as absolutely okay, and late deceleration, which doesn't considered as okay, and variable deceleration, it is something it requires treatment. Okay, so this is fine. Okay, and this is it requires treatment, but it is not like something life-threatened one. But variable deceleration, yes, it requires treatment. So we'll see what are the causes for each of these things. So early onset of deceleration or early deceleration due to a head compression, where the head is compressing the uterine soft, either pelvis or the cervix or something like that. Okay, but it is okay, fine. And late deceleration due to uteroplacental insufficiency. What is the basic reason for late deceleration? It is due to uteroplacental insufficiency. That means decreased blood supply to the placenta as well as the fetus. Fine. And this is something lethal. It is variable deceleration as because of umbilical cord compression. It requires immediate intervention. Fine. So these are the three types of decelerations and these are the causes of deceleration. I repeat, early deceleration is because of head compression and late deceleration is because of uteroplacental insufficiency, and third is variable deceleration. It is an emergency situations where it is because of umbilical cord compression. Okay, so we'll back to the question. So here the fetal heart rate is erratic. It is unpredictable. So what could be the answer? The answer is variable deceleration. Okay. Next question. A nurse is monitoring a client in labor and the nurse suspects umbilical cord compression if which of the following is noted on the external monitor tracing during contraction. So here the problem is umbilical cord compression. If the fetus has umbilical cord compression, okay, what happens when you see or when you assess the fetal heart rate, you will be able to identify variable deceleration. So the correct answer is variable deceleration. If you have some queries related with a deceleration, these three types of deceleration, please do not hesitate to contact me. You can just drop your doubts in the chat box or directly you can call me. Next question is the last question. During labor, the nurse observed variable deceleration on the external fetal heart rate monitor. Which is the best action for the nurse to take at this time? So here on the external monitor, there is a variable deceleration. Okay, so how do you manage? Apply an oxygen mask, change the woman's position to the left side and get the woman out of bed and walk her around and move the woman to the delivery room. So try to remove the wrong answer. Option number 4 is wrong and even option number 2 is also wrong. So what is the basic reason for variable deceleration? Already we have discussed it. Variable deceleration is due to umbilical cord compression. Okay, so how do you treat? Umbilical cord compression can be relieved by the second one. Change the woman's position to left side. Okay, so any doubts? If you have doubts, again, I am requesting you to contact me. Thank you for watching. Bye.